Hello, this is Stephanie Hayes doing a video on my laptop. This is gastrointestinal, and my goal is to get this video done before my food is done in the oven. So I have again American Girl doll. No willing participants to expose their abdomen, which is understandable. So I am going to introduce myself to the patient. Hello, my name is Stephanie. I will be your nurse today, and I'll be performing an abdominal gastrointestinal assessment. Can I get your name and date of birth? Check it against the chart. Hopefully I have the computer in the room and their wristband. During that time, I would be pulling the curtain and washing my hands as well. And for equipment, pretty much my hands for most of it, also stethoscope. If there are any wounds that I know of, I would assemble anything that I would need for that. But this patient has no wounds. So, I had, in the introduction, I told him I'm doing abdominal assessment. I wouldn't say gastrointestinal to them. Maybe. So I would let them know that I'm just going to be pushing on your stomach, listening to it, and observing the skin. As far as asking pertinent questions too, well, I would be asking the questions while I'm feeling around. But questions would be, like, do you have any trouble swallowing? Dysphagia, abdominal injury, abdominal pain. This can be when I ask about abdominal surgeries. Any bowel habits, usual. There's a lot of different questions I can ask. Hopefully they have it narrowed down to something that's bothering them. So for this, I'm going to want the patient to lay down flat, be in a gown, of course, so I can lift that, pull the blanket up, expose the area that I'm looking at. So I'm going to want the patient laying down. I'm just going to inspect the abdominal region. This girl's straight cloth, but I'm going to look to see if it's round, distended, flat. I'm going to see if there's any scarring, bruising, reddened areas, if there's any piercings, because some people do belly buttons, nipples, all types of piercings. So just looking and identifying and documenting whatever I am finding when I'm looking at the abdomen. So, whoops, oh well. I wouldn't just let that happen to a patient in the real world, but this doll, I am. Same with her legs when I go to show. When I'm looking, at that contour and the differences I'm seeing, I'm also going to be looking to see if it is symmetrical, making sure there's no lump over here that I can see, same size all the way around. I can also note if there's more adipose tissue in one area or the other, if it makes a difference, or like if it's significant to my findings. I'm going to want to, like I kind of said, look for different variations in colors, the piercings. Look for moles is another good one, along with scars. and any abnormalities, red patches like I had mentioned before. Then I'm gonna want to also make sure that the belly button is midline, centered, kind of, the X marks the spot, and inverted, so an any belly button. If I notice it is protruding, I can ask if the patient, if there's any significant history that would say that. I also know that could be a potential sign of an umbilical hernia. So, just questioning things, and some people just have it and they have it. But I think inquiring is like the safe way to go, just to make sure you're not missing something. And maybe they haven't looked at their belly button in a while, and that's something new to them. So just ask while you're documenting as well. If it is off to the side, it may be because of a surgery, or there may be an underlying circumstance underneath that's pulling that skin one way or the other. So always ask if it's not exactly where it should be. Is it normal for your belly button to be here? I just want to, explain. I want to know baseline for you. Make sure nothing's going on medically with that. Also, when you're doing this, you're going to want to, I can't really do it on her, pinch the skin up just to check the trigger. Make sure that they are hydrated, that the skin does bounce back. Also, back a hand for temperature, moist. I'm also going to want to look at the hair distribution. So generally males have diamond, generally females have the inverted triangle, but just looking and noting if there appears to be excess hair, patches of missing hair, alopecia could be very well happening. Just noting that if it's darker, coarse, beach fuzz. So just looking and documenting everything that I am seeing. And while I'm doing all these assessments, I do want to make sure, it looks weird because I'm looking at myself, but I should be looking at the camera to look at you. But I'm going to be asking them and watching them. Main thing is nonverbal cues. So if they, because guys sometimes like to play off the pain, so I'm going to be watching them, their face, while I'm like pushing and examining, and seeing if any area appears to be tender to them or painful. And inadvertently, you might find ticklish areas, just a side note. Some will watch their demeanor, facial expressions, hints at pain. As far as listening to the stomach, there are 4 quadrants generally. The right upper, right lower, left upper, left lower. Oops, just out of view. That's why I like to look there. So I'm going to listen just to the bowel sounds. Just use a diaphragm. It's looks ginormous on her. So you want to start at the right lower quadrant. listen for a minute each, because you want to know if it's hypoactive, hyperactive, normal active. So you're going to be listening for those vowel sounds, and to get a clear picture, because they do vary, like 3 to 5 seconds or 15 seconds. So you want to get a good read on maybe there's just an extra gas bubble, and you do that as normal active and it's really hypoactive. So starting down left lower quadrant, right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. And like I said, you're going to want to listen for a minute each, at least to get in the best assessment possible. Then when we're looking at the vascular sounds, you're going to want to listen for 4 major arteries, and you're going to want to use a bell. So let's see if I can do this. You're going to listen to the aorta, which comes down and kind of branches. So you're going to listen to that. Make sure that you hear that. You're going to listen to renal. So it's on the side, like right below the rib cages. So the aorta is going to be the one. The renal, you should listen to right and left. And then we're also going to do the iliac. It's going to be like by the hip bone is the best description I can think of. So you want to do that right and left as well. And then the femoral arteries, right in the groin. You want to listen to both sides as well. And this is with the bell side. And then once you've listened to the arteries and the bowel sounds, now is when you can percuss. So since I have to hold her up, this is a little hard, but let's try. You just, as in the videos before, put 2, 3 fingers and tap, and you'll hear that dull or timpani. This is letting you know where organs are. So the main ones that we can kind of get out of this percussion after doing the right lower quadrant, right upper, left lower. We are in, she's so tiny. We're going to percuss to the about the 12th bottom rib, and we're going to listen to where it becomes dull. That's an indicator of the liver. And then we are going to start where we hear some timpani down here and continue until where it's dull, so you can locate the liver. That's a cute little kite triangular T-bone. That's the best description of the shape. It will be over here. But you want to kind of remember those spots and see what the measurement is for it. And then as far as the spleen goes, again, you're going to listen for timpani and dullness and try to measure out. I look really big on it. Measure out width, length, to get an idea of how big the spleen is in that area. And then You can also do the palpation next. And with this especially, the palpation, you want to look for any kind of nonverbal feedback for pain, just being uncomfortable. I didn't make it. I'm going to stop this and start it again. Thanks.